So we'll starting the streaming in few seconds.
हेलो हाँ जी क्या हाल है वाह कई काम
Okay, then we'll start the meeting. Good evening, everybody, and welcome to this second edition of IJO on Air. And we have today with us Professor Rehanullah, and he is the Associate Editor for IJO, and he is going to talk to us on how to publish your thesis. We have the eminent panel from IJO editorial board, including Dr. Lalit Mani, the editor of IJO. So after the talk, we'll have some discussion points. If you have any questions, please use the chat option on the website, or you can send your questions to me directly. So welcome, Rehan, and we look forward to your talk. Over to you.
Good evening, everyone. I think first and foremost, I need to thank each and every member of the Indian Journal of Orthopedics who, in spite of these difficult times, have made this possible that we are able to discuss some sort of research and publication issues with all of you, especially Professor Lalit Mani and Dr. Ashok, who have been instrumental in organizing this webinar. So I am going to basically talk to you guys about something which is very close to my heart, about how to get your thesis published. Because if you look at how the timelines in India go, most of the time we tend to do a thesis. This thesis goes to the university, and after that it is just dumped. There are very few people who actually get their thesis published, and I personally feel that if your thesis is not published, it is actually a waste of lot of time which you have actually spent during your post graduation. So just to set the ball rolling, I will be just talking of these three important things which are the objectives of my talk. Number one, I'm going to talk to you or try to motivate you about why you must publish your thesis. Once that is done, I'm going to talk about how to go about the nitty gritties of converting your thesis into a manuscript which can be published. So, that is how to publish your thesis. And last but not the least, I'm going to talk of some do's and don'ts, because doing a thesis and getting it signed by your thesis guide and the other thing of getting a paper published in a reputed journal are two very different ball games. There are a lot of ethical and other issues involved when you're getting your manuscript published. So I'm going to talk of those do's and don'ts. So first things first, why publish? If you look at this photograph, most of us, even if this is not given, will identify him as Albert Einstein. And the reason we know him is because he could publish his work of E is equal to mc square in a paper. And remember, this was one of his thesis work which he actually continued to research on and then he published. Therefore, if you do not publish what you are researching, all that research actually goes waste. You are recognized, and science progresses only when something which has been researched is actually published. So this is the most important reason you need to publish, because if you don't publish, that research is actually a waste. On a more point-wise basis, you may do a research because of personal satisfaction, because it gives you happiness. Okay, I've done some research, it is published in a reputed journal. It may be mandatory for you to publish, because for somebody like me who's working in a teaching hospital and who has a lot of postgraduates and senior residents working under him, the idea is you need to continue to build up your CV, because if you do not build up your CV, you will not be appointed to higher posts and you will not be promoted. But looking at current scenario, I've been thinking, I think the single most important reason because of which you need to publish is because you have to improve clinical practice and you have to grow science. If you look at today's scenario, we are all in a lockdown sort of a situation. And people are talking of when the lockdown is going to open, when are we going to have a normal sort of life. I think the single most important answer to this is people are going to do research. People are going to come out with some sort of a vaccine for this coronavirus. People are going to find out some sort of drugs for this, and only after that life is going to become normal. So unless and until you do not do research and you do not advance the frontiers of science, I think human movement and human growth is actually not possible. And this is the single most important reason as to why you must do research. And once you have done your research, you need to publish it. I'm not saying at this juncture that your thesis should be of a standard that it may take care of worldwide problems, but it will put into your heart and soul the idea of how to do research, and then it will become a lifelong exercise for you. And maybe as you move forward in your career, you're going to do research which is actually going to influence clinical policy and decisions. So I think the single most important step, if you are thinking of getting your thesis published, is to choose a good topic. Because if you do not choose a good topic, it is never going to be published. And the idea is, if when we just talk of how to do, find out a good topic which is good for your thesis and which is good for your research, I think most of the time it is the thesis guide which who guides you as to the topic you need to take. But once the thesis guide has given you a broad sort of an idea, for example, I mainly do hip and knee surgery, so most of my thesis will be around hip and knee surgeries. I will give some sort of a broad idea to my postgraduate about the sort of research which I would like to do. It is the role of the postgraduate at that juncture to find out as much literature about the topic which has been discussed. So it is called the funnel approach. What you're trying to do is identifying a big topic, bringing it down narrow to a research question, and then a research hypothesis. And that is what becomes your research question, and that is the research that you do. And if this research is good, it is published. So try to find a good topic, and it is not only the duty of the thesis guide to give you a topic which is publishable, but a lot of effort on the postgraduate part goes to get that published. So these are the qualities of a good topic. It should be new, it should be true, it should be important, it should be of interest to the target readers, and it should advance knowledge and understanding of certain fields. So this is paramount. The problem which comes in a thesis is it is a limited duration thing. You have to do your thesis in say 18 months or 24 months maximum. And the student always has the problem of how can I do some sort of new or a groundbreaking research in this period. What I would like to suggest to all of you is it is actually possible. The way to go about it is to find something new. For example, I always give an example of tibia. If you have a proximal tibia fracture, there are hundreds of paper on the classification of proximal tibial fractures. There are hundreds of paper on the functional outcome, the radiological outcome after proximal tibial fractures. However, if you want to add something new, you can just change your outcome measure. You can say, okay, I want to look at the patient reported outcome measures following a tibial plateau fracture at 6 months. So, patient reported outcome measures where the patient is telling you as to how he is feeling after a tibial plateau fracture has not been published in the literature. So, it becomes new. So, the idea is you have to do something which is innovative and you have to do it in a way that you can do it within your system. However, if you're doing a research on something which is too well known, something which is too specialist, something which is very confusing, which normal people will not understand, something which is too far removed from patient care or public policy, I am afraid to say that you may do a good thesis, but it will become very difficult for you to get it published. So don't try to fall into that trap. Try to do something from this group of uh, titles which I've given you. And again, remember, converting your thesis into a publication or a manuscript is a very difficult ballgame because the structure and the style of a thesis is completely different from that of a manuscript. If you look at the thesis, you will usually have an introduction followed by a review of literature. Then you have aims and objectives. Then you have material method, results, discussion, summary, and conclusion. On the contrary, when you are trying to write a manuscript, this is the format which most of the journals will accept. So there is a title, there are authors, there is an abstract. Remember, there is nothing like an abstract in a thesis. Then you have something like keywords and mesh terms, and then you have introduction, method, results, and finally a discussion. Coming towards the end, you will have acknowledgements, references, and supplementary materials. So the idea is once you have got your thesis signed by your thesis guide and accepted by the university and also endorsed by the externals, the moment you find time, you have to convert it into this style, and it is only then that it will be accepted. So I'm going to touch on each aspect of how to go about it. So first things first, if you look at your thesis, it is almost around 100 to 120 page document and is around 40,000 words, while a manuscript is only around 4,000 words. So the idea is to do edit. You have to edit it to almost one tenth of its original length, and only then you can convert it into a manuscript, which will be good enough for submission, and only once it is good enough for submission will it be good enough for publication, right? So the first thing is you have to do a ruthless editing of your uh, thesis to get it converted into a manuscript. So how to go about it? If you look at the introduction in your thesis, the introduction is quite detailed. It is almost around 4 to 5 pages, and you discuss threadbare about the topic which you are discussing. However, when you're going to come to your paper, your introduction will be very short. It will be just 3 paragraphs. The first paragraph is going to talk about what is known about the problem that you are going to research. The second paragraph is what is not known. So the first paragraph is what is known about the problem that you're going to research. The second paragraph is what is not known or what is the confusion about. And the third paragraph is what are you going to do. So it is very simple. What is known, what is not known, what are you going to research. And remember, in your publication, there is nothing like a review of literature or nothing like the aims and objectives. So it is in your introduction that in the last paragraph where you're going to talk of what are you going to do, you are going to put in your aims and objectives. So just 3 paragraphs in your introduction section. Moving ahead is the methods section. Remember, the manuscript will have no review of literature. The manuscript will have no aims and objectives, right? It is just an introduction followed by material and method. So in the material and method section, again, when you're writing your thesis, it is a very elaborate and an extensive sort of a presentation. For example, again, taking a hip example, if I was to use the Harris hip score as an objective score, there is a possibility that I may introduce a part of the Harris hip score when I am writing the method section, that this is my outcome measure, this is the Harris hip score, these are the points of the Harris hip score, right? However, when you're going to do your publication or convert it into a manuscript, the material and method section again will be shortened to almost one third of the length it was there in your thesis. And for the Harris hip score, for example, you're just going to give the reference and move ahead. So you're not going to discuss the Harris hip score. You're just going to give a reference about it and then you're going to move ahead. So the method section again is shortened significantly. Coming to the after the material and method, you will have your result section. And this is one of the more major areas which needs to be converted properly when you are submitting your manuscript, because as reviewers, as editors, we find that most of the time what the student does is he takes his results and he pastes it into a manuscript and he submits it to the editor, and the editor has no option just to reject it, right? So the idea that you really need to do is in the results of your thesis, you will have a lot of tables, you will have a lot of graphs, you will have a lot of pie charts, you will also have a lot of theory. In your result section, all this has to be cut short and it has to be brought down to just these 4 points, which I personally call it the kite format. So you will have participant data, which is basically the demographic data of the patient, how many males are there, how many females are there, what is their age distribution, and the other things which are important from your point of view. After that, you're going to talk about the participant flow and the baseline data. That means how many patients were actually enrolled for the study. That means how many fulfilled the inclusion and the exclusion criteria, how many patients were operated or how many patients were treated, and then finally you're going to talk of how many patients could be followed up and finish it off here, right? But this is not the most important results that you have to discuss. The most important results that you have to discuss is the outcome data. Please remember, in your thesis you would have mostly one primary objective and a number of secondary objectives. When you are writing your paper, in order to concise it and in order to make it more attractive for the reviewers and for the editor so that it is published, it is a good idea to drop some of the secondary objectives and just focus on the primary objective, right? And then give your outcome data only about the primary objective. So if you were in your thesis, if you were looking up about 3 things, for example, let us say a hip case, you are looking at radiological outcome, you are looking at functional outcome, and you are looking at the patient reported outcome measures. Probably when you are doing your manuscript and trying to get it published, it will be just one objective, which is looking at the prompts following any sort of hip fracture. So this anyway will be reduced. Last but not the least, talk of what is known as ancillary data and others. So, for example, you're going to talk of complications and the other things. So, this is how the results section of your thesis will have to be converted into a very concise, brief paragraph if you want to get it published as a paper. Again, coming to the discussion and the conclusion part, remember the discussion just needs to have 4 points when you're writing a manuscript. You have to discuss your results without quoting the data. That is the first point. That means what did you find in your research? Number two, you are going to compare your results with other published studies. So if I am looking at the radiological outcome following fracture neck femur, I am going to compare my results of radiological union with other published studies of fracture neck femur. And I am going to compare them with results on either side. That means some people will say that my radiological union happened at 6 months, others will say at 8 months. If my results were at 7 months, I'm going to compare with both. And I'm going to say that, okay, my results were somewhere in between of the previous study. So don't just compare with only one type of studies, try to compare with studies on both sides. And after that, you're going to discuss the strengths and limitations of your study. And last but not the least, the directions for future research. So very concise and brief discussion, 4 paragraphs. First paragraphs are, what are your results? What did you find? Number two, comparison of your results with other studies. Number three, the strengths and limitations of your study. And last but not the least, the directions for future research and directions for further policy changes. That is how you are going to complete your discussion. This is unlike in your thesis, where the discussion is much more elaborate and it continues to go on for a very long period of time. Again, an important aspect in your thesis, as I said, there is nothing like an abstract. While in your manuscript, the abstract is probably the single most important thing which is there, because most of the time the people will be reading your abstract, they will be judging the quality of your paper based on the abstract that you have given, and they're going to study or read it further only if the abstract is good and it is of their value to them. So there are basically 2 ways of writing an abstract. Number one is a structured abstract, like the one with the Indian Journal of Orthopedic wants. So you have something like a background, and then you have material method, you have results, and finally a discussion and a conclusion. Unlike this, you may have an unstructured abstract, like the JBJS British of the old times used to take, where it is just one single paragraph. So you have to read the journal guidelines as to what sort of an abstract they want, and based on that, you can do a structured abstract or an unstructured abstract. Both are acceptable, but you need to decide what sort of the one you want to write based on in which uh, thesis you are converting and where you want to publish it. Again, limit the number of your references. If you're going to look at your thesis, it will have around 80 to 100 references, while in your paper the idea is to limit it to around 20 to 30. How are you going to do it? The question is, you need to just retain the references which are very important. And when I say important, I mean three things. Number one, references which are recent, that means of the last 5 to 10 years. References which quote the primary articles. So, for example, you may have the Harris Hep score, again taking the example. It has been quoted in almost thousands of articles, but when you are using it for your thesis, you may take 3 or 4 references of the Harris Hep score, but when you are publishing, you're going to take the original reference of where the Harris Hep score was published for the first time. So that is the primary reference for the Harris Hep score. That is the one you're going to use. The others you're going to drop. So that is reducing your references from almost 80 to 100 to around 30 to 40. The third thing is, when you're taking reference, take references of index journals rather than taking that from the website, from unpublished works or theses which have been submitted to a university. Those are not references for a manuscript. Those can be references for a thesis only. And remember, when you are publishing or when you are writing a manuscript, nothing is trivial. So you need to know how to write the title. I'm not, because of shortness of time, I'm not going to discuss how a title is discussed. But remember, it has 4 parts. It's called the PICO format. So the patient, the intervention, the comparator, and the outcome measures have to come. You need to discuss with all your colleagues who you think are authors to that. There are very strict guidelines about authorship. So do not gift an authorship to someone who has not contributed to your paper, or do not get in somebody who has not done anything. So that is actually a publication misconduct, should not be done. Abstract we have discussed. Remember, I would like to talk very briefly about the medical subject headings. Most of you know how to use the PubMed, and remember, the PubMed will search your article based on these medical subject headings. So choose them properly, because this is going to decide how frequently your paper is going to be searched when an electronic search for your article is done. We have already talked of introduction, method, results, and discussion. Please remember, there will be some people who are authors, and those who are not but who have helped you can be there in the acknowledgements. For example, you have taken the help of a statistician. You can give, you should not give him any authorship, right? But yes, you can acknowledge him, and then references and supplementary material we have already discussed. One more important point, choose your journal very judiciously. For example, something is very obvious. If it is a trauma paper, don't send it to the journal of arthroplasty. If it is an arthroplasty paper, don't send it to a journal of trauma, right? Similarly, if you look at the Indian Journal of Orthopedics, this is a journal which basically focuses for clinicians who are practicing in the Indian subcontinent and also outside. So we tend to accept papers which are more clinical rather than papers which are more of basic science or the other thing. So you have to actually, once you have done your manuscript and you have done your research and converted it into a good manuscript, look at the journals which are going to accept it and just send it to that journal. Because if you do not send it to that journal, there is a very high chance that your paper may actually get rejected, right? And remember the guidelines. Remember, you will, if you have done, if you're submitting to the Indian Journal of Orthopedics, you will have the instructions to authors, you will have to use it. If you're doing a randomized control sort of a trial, there are something like consort guidelines. There are, if you're doing an observational study, there are guidelines like the stroke guidelines, and all these are available on a network known as www.equator.com. You can go there, understand how you should structure your paper, and always use the guidelines when you're writing your manuscript. some important do's and don'ts. I think I'm just going to concentrate on one thing, which is known as plagiarism. In today's world and today's time, there is a tendency of cutting things from one side and pasting them into your own manuscript, and this happens very frequently in a thesis. Remember
हेलो
this when hello.
हाँ संजय से बात हो गई, वो तो कह रहा है कि
Remember when
कैमरा
you're
मेरे
doing
कंट्रोल में चल रहा है। मैंने कहा अच्छा ठीक है।
remember when you're doing it, this is not acceptable at all, because this is taking somebody else's idea and trying to depict it in a way that it is your own, and this is a strict no-no as far as publication is concerned. And very recently, even the UGC has notified that if your paper or even your thesis is plagiarized, then not only the student but also his thesis guide will be punished. So do not indulge in any sort of plagiarism, and do not indulge in any sort of other research and publication misconduct which I have depicted in this table. So, the clear take home message which I would like to give you is that publication of your research is very important. If you do not publish your research, then that research is actually useless, because nobody else is going to know about it, and your research paper or your publication is just going to gather dust in some corner of a library, which is not a good idea. You have put in so many years and so much time in doing it. When your thesis is ready, work on each area of the thesis according to the guidelines and instructions to authors, so that it is converted into a manuscript which will attract not only the editors but will also attract the reviewers, so that it is finally published. Last but not the least, research and publication misconduct must be avoided at all costs. So thank you, and I would like to acknowledge all the previous past editors of the Indian Journal of Orthopedics and current editor Dr. Lalit Maini for giving me this opportunity and helping me to discuss something which is very close to my heart. I think Ashok can take over from here. Dr. Ashok and Lalit can join.
Thank you very much, Rehan, for that beautiful talk. So before we get to discussion, I have received quite a few questions from the audience.
Yeah.
Maybe we can take on this, and also if panelists wants to ask any questions. So one question is quite important.
Right.
Dr. Sai from Karnataka is asking, when we are many of the journals are asking this ethical approval statement for submissions.
Right.
So when we are converting a thesis to paper, we take ethical approvals for our thesis. Is
Right.
the same ethical approval valid when we submit the paper to a journal?
Yeah, so please remember, nowadays the guidelines are very strict. Any thesis which is done in any medical college, they will take an ethics approval for that, right? And
Yeah,
that ethics approval is actually good enough for when you are submitting it for your, when you're converting it into a manuscript and then sending it for publication, right? This
right.
confusion arises because most of the times there is a slight difference between the thesis and the manuscript that has been prepared. The title may change a little bit, the contents and the objectives may change a little bit, because you may actually reduce the number of objectives that you had in your thesis to just one or two when you're using your manuscript. So that is acceptable, and you just have to quote the ethics approval committee number of what you had got at the time of your thesis approval. So that is good enough.
If I can add to it, while sending that letter, add a covering letter to the editor stating that this was a thesis and the same data is utilized to make the paper as a part of the complete data set. So that will, I think, mostly get accepted. Any views on that, Manisa?
Yeah, there's another route which our ethics committee accepts. We have raised this point because
Mm-hmm.
when we do our protocol presentation and get an approval, at times they give an approval of all the orthopedic protocols in one letter. So it carries a single letter and a date. So we had raised this point, and they had actually agreed if you want to send for a publication and you want to have a specific number for your paper, and also this part in which the title of your paper is changing. So both the things, if you request your ethics, they will give you a corrigendum letter, and that will be a totally appropriate document for journals which are very, very strict on this.
Okay. So that can be obtained even later on.
Yeah.
Okay. So that's another rule I didn't know about. Any other panelist has any other view on that?
But then all the postgraduates should get into the habit of registering their thesis before starting their first case in their thesis. That's now required and it is mandatory.
So registering to CTRI.
Yeah.
Okay. Because most of the students, especially in orthopedics, are not doing it. A lot of others in medical branches are doing it, but orthopedics is very low. The CTRI registration is very low for orthopedics. So that's a valid point, and all the viewers that are listening, just find out what is CTRI, Google it, and you'll get the details. Submit your thesis if you're in first year and second year, and get a CTRI number. Okay, so let's move on to the next question. Question is asked many times, and it is a very general question to Rehan and to everybody. Which is the best journal to publish my thesis as a paper? Of course, there are multiple ways to look at it, but go ahead, Rehan.
Yeah, I think like what Ashok is saying, there are multiple ways of looking at what sort of a journal you would want to publish your thesis or your manuscript in. First and foremost, my idea is go to that journal and look at the sort of papers that are actually published. Sometimes the title of the journal will actually give you a clue. So, like I said, even in my lecture, if it is a journal of arthroplasty, except that it is going to publish only papers on arthroplasty. If you have done a research on arthroplasty, try to send it to there. If it is a journal of trauma, it is going to accept papers on trauma. But if you have a generic sort of a journal, like for example, the Indian Journal of Orthopedics, the best idea is look at the journal, look at the previous 2 or 3 issues, and you're going to get an idea about what are the sort of papers which are accepted. For example, in the Indian Journal of Orthopedics, I always find and we always try to do is that we take papers which are more clinically oriented. So if you have a clinically oriented paper, it is a good idea to send it to the Indian Journal of Orthopedics. If you have a more research sort of a paper, probably it is a better idea to send it to a journal where more basic research or primary research sort of paper is published. The other thing is, once you're doing your review of literature, you will have some degree of idea as to how good or how bad your research actually is. Where does it stand in the scheme of things of the already published material? So if your research is not very high quality, I don't advocate sending it to a very high impact journal, because it is just going to reject it very quickly and then you are going to be disappointed. So try to balance it out and send it to a journal where you think that quality wise it is accepted, right? I think others can add on to what I have said.
Yeah, many sir, you can add on to, then others will also add on to it.
One big limiting factor has become the article processing fee. So please look at that, which is if it is required in a particular journal and you are ready to take that. And then there would always be biases, like an orthoplasty journal will definitely take orthoplasty. Similarly, there would be a regional bias. If your paper is related to an Indian problem and you send it to a South African journal, it's going to get rejected. And there's going to be another bias. We as an Indian Journal of Orthopedics would like to accept more and more Indian publications. So if you ask me a straightforward question, which is the best journal, I think send it to Indian Journal of Orthopedics first. You'll definitely get a good guide ahead on where you stand. And in the heart of hearts, invariably, when you do a research, you know where you stand, where it's going to get published.
I was wanting that answer from you, sir. Submit to IJO. So, if I may add, a part of this question is a corollary that says also to know where not to publish, especially with respect to predatory journals, which I think we'll cover in forthcoming series in this IJO-on-air. But be aware of where not to publish also, along with where to publish. So, other panelists, if they want to add to it. Yeah, Praveen, you want to add something? Unmute yourself. Okay.
So, yeah, just adding on to what you said, I was about to make the same point, because these you'll be swamped with journals, and there's n number of journals willing to publish any work for when you pay the fee, basically. So they need to be wary of that. The second thing that you should check is the journal is PubMed indexed, and that's what you should aim for. And if you know that your research is of a certain quality, then you should always aspire to publish in a PubMed index journal, or a journal that is indexed in some other reputed database like Embase.
Right. Anything from Karthik or Srinivas? Yeah, Karthik, go ahead.
So I want to when the thesis, when it is planned, another important size. So that would be helpful, whether your study has got enough sample. That is something which is neglected, but if that can be addressed by the mentor or the PG guide, that will also students to know that whether the study is it able to. Thesis, most of the students aim for 20 or 30. That depending on the topic.
Right.
Am I audible, Dr.
Yeah,
Sham?
you're audible.
Dr.
Your voice
Ashok,
was you're audible.
So,
your voice was breaking in between, but now it is fine. Go ahead.
Okay. So the sample size is crucial. We taught to our students and re-emphasize that is the most important thing or not. In an ideal world, we can do RCTs. And prospective studies better than retrospective. Again, to get those numbers is always a challenge. Working in a teaching institute, we know the challenges. But if we can acknowledge the bias in the study, that also will be helpful. Various types of bias which happen in studies. That will also help them to acknowledge on their own.
Right.
Can I?
Yeah, Praveen, you wanted to add something?
Yeah, just add. Yeah, I wanted to add to what Dr. Rehan said initially about not sending the work to a journal where it's likely to be rejected. I have a slightly different perspective. I actually encourage you to submit to the best journal where you think you have the best shot. Rejection is a good thing. So if you send it to a good journal and get rejected, you will always get pointers that will help you improve the paper and get it submitted to maybe the journal which was your second option. But go for the highest that you think you have a chance.
Perfect.
I would recommend, after you complete writing your paper, you show it to your mentor or somebody who has published before. So they'll be able to assess the quality of your paper, as well as they can suggest which journal you can send the paper to as well.
Right. Okay. If Sasinder is around, he can contribute. Okay. Okay. Anyways, we move on to next question. Rehan, this is a really difficult one.
Yeah,
and you're going to feel late first. So the question goes, can you give us detail about the authorship form if I convert my thesis to a paper? So what will be the sequence on authors? Will my guide be the first author all the time? And who will be the credited, who all will be credited and share of the credit for the paper, not the thesis? Yeah.
I think this is a very difficult sort of a question to answer. I think if you look at a PG thesis, there are two people who are very important. Number one is the PG student who has actually done that thesis. And the second person is the thesis guide. And the confusion is between who should be the first author and the subsequent authors, right? So in my opinion, as of now, after being a thesis guide for almost 10 years, I feel that the PG student should be the first author, right? And the thesis guide probably can be the last author and he can be the corresponding author. This is how I usually go about with my arrangements. But some of the thesis guides have a different opinion on that. They believe that if they're doing very high level research, for example, they have been doing a research on certain topic for almost 15, 20 years, the PG student is just a part of a larger scheme of things. And in that sort of a picture, probably the thesis guide can be the first author. But yes, definitely it is difficult. For me, it will be the student will be the first author. I may be the last author and be a corresponding author if I think that I have contributed enough to that. And there can be one or two other people in between, and that is how it will go. Probably others may have a slightly different opinion than what I'm saying.
Yeah, Mani sir, over to you.
If you go by the rules, authorship should be decided at the time you begin your research, so
Right.
that the roles and the responsibilities are defined and there's no confusion later on. But it never happens that way. But we are gradually getting into that behavior. And in practicality, this confusion on who's going to be first author remains. If you want to develop some system in your units, one way could be, for step one is decide authorship in the beginning itself, but then convey your team that if somebody doesn't perform on what he's supposed to be, he goes down one ladder in the authorship list. So that keeps the team motivated and working around. And the other point is that if you have 6 authors and 4 authors, this is another different scenario, because with the changing guidelines of MCI, now it says that three authors, the first 3 authors would be recognized and a corresponding author. Now, probably if we have 4 authors, there is no issue, because the publications are both valued by the PG student as well as the faculty. All promotions are now linked with the publications. So this is going to have impact on both. So if it is a team of 4, then there's no problem actually. And the PG should be the first and the guide should be the last, and 2 more team members who have contributed in. But then I think get into the behavior of deciding the authorship when you begin the thesis.
Yeah. Anybody else wants to add to that, these points? Yes, Asinder, go ahead.
I think sometimes in the cases guide, the primary research lands.
Your audio is not very clear.
Is it better?
Yeah, better.
Yeah, sorry. I think when it happens that the primary surgeon or the thesis guide lands up in discovering something new, like a new technique or a new concept or something, that is when it usually happens that the guide will like to be the first author. But as suggested by Lalit Mani sir, the PG can go one step below if the thesis guide wants, but possibly not push too much behind. So it is an encouragement for the postgraduate.
Right.
So if you go by international standards, it's very clear that the last author is the senior most actually in the team and is the guiding force behind any publication. It's very clear. There's no confusion there. So if you go for an interview anywhere globally and your name is on the last and your professor is first, it just raises eyebrows. So it's not going to help anybody.
Right. Absolutely.
Yeah, that's exactly right. But I do see medical colleges where the postgraduate is specifically sort of harassed into pushing into last. That's a sorry state that is happening in some places.
And specifically because of the MCI guidelines, because which give weightage to the first 3 authors. That's the reason why, maybe.
Maybe we can bring in a guideline in IJO that PG can't be the last author.
Hey, yeah, that will be very, very encouraging.
That should be good.
Yeah,
Very
that will be encouraging for students.
Yeah, I think as Dr. Mani said, if there is 4 authors, I don't think there's any problem. But what happens is most journals allow 6 authors usually, and then it's a problem for the remaining 2 where they slot in terms of promotions and all.
Right. Okay. Should we move on to the next one?
Yes.
So another question is again important. What is the time limit to publish my thesis? I've finished my thesis this year. Till what time can I publish it? Because many times it's not very stable time for them when they finish their curriculum.
So what practically happens is they submit their thesis at the end of the second year.
Yeah.
And I've never seen anybody publishing within the PG time. It will happen in the first year of a senior residency.
Right.
So, but then if you ask me what is a good time, the more you delay, the more you're going on the downside. So practically don't postpone your publication by any means beyond 2 years.
Okay. Any other panelists have an opinion on that?
Yeah, if the time permits, the final year could be a right time. When, like, for example, when you are preparing the dissertation, that is, if you have some sort of experience in writing case report, then you can straight away start writing the manuscript for your publication also. And with approval of the thesis guide, you can make up the paper. Usually what happens is after publication, people start roaming around trying to get more hands and exposure, and it gets pushed forward. And I have seen people asking me guidance after 6 years or 10 years down the line, they want to publish their thesis. So it doesn't make much of a sense because evidence keeps changing a lot, and it's not exactly right to publish a paper after 6 years or 10 years. So you can start working along with the final year post graduation, and at least try to publish then or immediately after you complete the post graduation, you can publish it.
Right. Anybody else wants to contribute, or we move to the next one? I think this is the last question that we can take.
Go to the next one. Yeah.
Yeah.
So, Ashok, if you want to sort of push the PGs who are listening to this seminar,
Yeah.
I think for this particular year, all these postgraduates are labeled as COVID postgraduates.
Yeah.
So why don't they redefine life? Probably time with them and their seniors is a bit more. And this month end is a thesis submission. Most of the guys have finished their work, but they're just not doing it because probably the dates have been extended. So I
Yes.
think this is the year that you finish your thesis and publish it within the next 2 months, because you're going to have some time with you and your colleagues.
Perfect advice.
Correct.
Perfect
Correct
advice.
advice, yeah.
Yeah. So this is the last question. Can I publish my full thesis and a paper based on the thesis separately?
Srinivas, Salami.
Yeah. Yeah, Rehan, take it.
Can I answer that?
Yeah, Rehan, take it. Yeah.
So I think this is what the problem is. Sometimes the student will do a thesis and he would want to get 3 or 4 or maybe more publications out of it. In an ideal sort of a situation, this is actually what we call as salami slicing. That means you have taken one pool of data and you have divided into 4 or 5 different publications. The idea is just to increase the number of publications, and this is a type of ethical misconduct should be avoided. But the problem is, like we were talking, the thesis is almost around 40,000 words. It has to be reduced to 4,000 words. So what is the way to go about it? What we normally suggest, or what most of the postgraduates will do, if you have 3 or 4 objectives in your thesis, you reduce your 3 or 4 objectives to say just 1 or 2, and then publish a paper based on your most important objectives, and that is good enough. Don't try to publish a paper on every single objective. However, if you move away from a medical thesis and you go on to theses which are like PhD thesis or thesis even in the universities, there is a group of people who feel that if there is significant volume of work which has been done in the thesis and you can have more than one publication, then probably 1 or 2 is good enough, but not definitely for a medical postgraduate thesis.
Perfect. Anybody else wants to add?
So the answer is a straight no, very clear.
Right.
People go ahead doing this, they publish their series, and the complication which they had in their series, one complication, that they publish it as a case report. Now this is a huge amount of self-plagiarism. So the straight answer is no. As Rehan has told, it's different in PhD thesis. PhD thesis is working in a way that it is supposed to be coming out with more than one publication. And even there, the publications are actually systematic reviews on the topics which the person is working on. Although the original work which comes out is probably one main work which comes out.
Right.
I think with postdoctoral thesis, they publish multiple papers, but for postgraduate dissertations, I don't think they'll be able to publish many from that.
Right. Karthik, go ahead.
The best practice would be, if you have a very big topic and you have looked at various parameters, the best would be to write to the journal where you are proposing to submit and ask them, look, this is the type of data I'm having. Would it be acceptable to submit it as 2 papers? If they accept it, that is okay. But I would, in principle, say you can't publish a paper which could have been published, because most of the journals have a word limit of 2.
Yeah, agree.
Justice to that topic. Otherwise,
yeah, we're losing his audio.
as everybody
Okay, we got your point, Karthik. You mean to say inform the editors and then take a call on if it is a big topic.
Yeah, so you inform them and then.
Okay. Yeah, Sasinder, you wanted to add something? Go ahead.
Yeah. That's fine. Actually, I was also wondering, suppose you have a big list of cases that you have done. You can, I mean, I'm just asking suggestions of the seniors over here. Suppose you have a list of femoral fracture nailing that you have done and you have compared with fitting. But on, you want to also write another paper on the complications of nailing and how to avoid the complication. So it's not actually a replication of the data that you have used for one paper, but it's actually another descriptive paper that you're writing on what are the complications and methods to avoid it. Is that acceptable?
Many, sir.
So we come down to the definition again, and if you go to salami slicing, the definition is that you should get out only one paper out of a study. So if you look at studies which are done, especially the thesis studies, they will never have huge data. They will be always struggling for data and numbers.
Yeah,
so it will never be a scenario that you have so much content in a thesis that you can present. But however, if you are doing a femoral nailing thesis and you want to do a systematic review on complications of femoral nailing, that's a totally different study in itself.
Right. Anybody else wants to add to that?
Yeah, I think what I will say is what Dr. Lalit is saying. For a postgraduate thesis, you just have 18 months, right? And
Yeah.
you have very limited number of patients. Most of the time, only one publication is going to come out of it, and even that is a bonus. However, if you're doing an ongoing sort of a research, for example, you're doing a research on TKR, right? And you have done 50 cases and you have followed them up for 5 years. You continue to do your TKRs, you follow them up for 10 years, right?
Yeah.
So in that case, there are papers coming out 5 years, 10 years, 15 years, 20 years. In those cases, you have to inform the editorial board that this is an ongoing sort of a project where initially I had 50, now it is 100 and the follow-up has increased, and this is the previous publication which you're going to quote, and then it is not a sort of salami slicing or it is not a self-plagiarized sort of thing. When you have already declared that this is a larger pool with a larger follow-up, that is fair enough. But for a postgraduate thesis, I think one paper is good enough.
That becomes actually a newer study. Classical example in Indian literature is Dr. Bakshi's elbow processes. So we have papers on maybe a 1 year follow-up and a 3 year and a 5 year and a 15 year and increasing number of sample size. So they actually become different studies. Like we are looking at larger duration and what happens to the processes and all those things. So I think the message should be clear that try to get out only one publication. As Rehan said, that one publication is actually a bonus. According to me, the publication rate of Indian orthopedic thesis is 0.1%.
Yeah, possibly. Okay, I think that was a very interesting session. Any of the panelists have any questions for Rehan? on their comments?
Rehan has done a very, very nice job. The presentation was very, very clear and crisp. I hope the students are going to revisit this video and sort of clear points which they have missed out.
Yeah, we have around 600 people with us. So I hope we'll have more who will watch it over a period of time. And we'll make this entire series available on one page, so easy to go through. So I think it's covered, Rehan has covered very well the topic, and this should be circulated widely for all the students. We look forward for the next week. Again, we'll decide the topic and announce it maybe 2-3 days before next Thursday. And we see you all. Thank you very much.
Thank you.
Thank you.
Bye.